Hey there, my name is Philip Ruth, and we're here outside the San Francisco Chronicle headquarters in San Francisco, and this is the MRSA Action Group protesting the article that ran January 15, 2008 that painted the MRSA outbreak as a gay disease. And the MRSA Action Group is here to protest that. So, here we go.
What do we want? Apology! When do we want it? Now! What do we want? Apology! When do we want it? Now! What do we want? Apology! When do we want it? Now! What's our message here today?
The Chronicle is
Anti-gay! What's our message here today?
The Chronicle is anti-gay!
What's our message here today?
The Chronicle is anti-gay!
Sabin Russell, you can't hide! Your MRSA story was full of lies. The gaps and holes were deep and wide. The story left us stupefied. Your attitude ran its snide. We think you should apologize.
Apologize!
What's our message here today?
The Chronicle is anti-gay!
What's our message here today?
The Chronicle is anti-gay!
The gay community under attack. What do?
We fight back!
What do we want?
An apology!
When do we want it?
Now!
What do we want?
An apology!
When do we want it?
Now!
What do we want?
An apology!
When do we want it?
Now!
What do we want?
An apology!
When do we want it?
Now!
Sabin Russell, you can't hide.
It's time for you to apologize!
It's time for you to apologize. What's our message here today?
Chronicle is anti-gay!
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 What's our message here today? Better coverage on MRSA. What's our message here today? Better coverage on MRSA. People with staff under attack. What do?
We fight back! We fight back!
Sabin Russell, you can't hide.
You to apologize!
Okay, so we're here today with the MRSA Action Group with Dr. Rick Loftus.
Hi.
Hey, and so tell us what we're doing here today.
Well, for people who don't know, back in January, the Chronicle ran a story suggesting that there was an outbreak of sexually transmitted staph in the gay community located in the Castro. They were talking about a very specific kind of staph. Staph is the bacteria that causes pimples and boils. But in the last 10 years, we've seen the emergence of something called MRSA, a kind of aggressive staph infection. There's a team of researchers at UCSF that has been studying the MRSA problem in the city, and they believe they had found some evidence that MRSA was being spread and concentrated in the Castro neighborhood. Some of their research suggested that it might be sexually transmitted. The Chronicle did a story about the paper, and it caused a widespread panic. Unfortunately, that story was picked up by newspapers all over the world, including Australia and England, suggesting that the gay community had become a source of a killer plague. In point of fact, MRSA affects communities of all types. In my own practice, I have seen nursing mothers come down with MRSA. I've seen elderly people in nursing homes come down with it. The gay community is affected, but really all parts of our population are affected by MRSA. So a lot of people in the community in January were really angry to see the gay community once again be described as spreaders of a killer disease. Rather unfairly, the scientific evidence is very preliminary, and staph is spread by skin-to-skin contact. In fact, the very first paper that was done on sexual spread of MRSA was on heterosexual couples. That didn't make it to the cover of the newspapers, but for some reason when they talked about the problem in the gay community, all of a sudden it's front page news all over the world.
So what was your initial reaction when you saw the article? Did you get any advance notice that this would be coming out? Or?
No, but I actually had been following the work of that research team, so I was familiar with their findings.
Oh, okay.
And I actually wasn't surprised by what they were describing in the Castro, but I found it just another example of the MRSA problem citywide. So it's just another population that's affected. Now, it's a population that I happen to take care of because I'm a doctor in the Castro neighborhood, but I know that it affects a lot of other groups as well. I think what was most distressing about it was how this story was picked up by hate groups, especially in other parts of the country. Concerned Women for America, for instance, have used this story as a platform now for launching a new anti-gay campaign nationwide. So unfortunately what's happened is that a piece of very preliminary science was received rather uncritically by the editors of the Chronicle and turned into a story that caused widespread panic. So a community meeting was held in January to discuss people's anger about the story, and I suggested that if people wanted to do something about it, they should organize. So we created MRSA Action Group as a way to let the Chronicle know that we want their coverage to be a little bit more responsible, a little bit more intelligent and critical. We want them to pay attention to the larger problem of MRSA in the city and not just stigmatize one community unfairly. We're also hoping to take our message to UCSF. We're working on a report that we hope to release later this spring that will call for more regional leadership around this. We need our universities like Stanford and UCSF to pony up some help in getting a better sense of how widespread this problem is. Our health department is already overwhelmed. They don't have a surveillance system in place. In fact, the state of California has no surveillance system in place to track MRSA infections. Members of our group have already contacted 10 health departments nationwide, and the answer we're getting from all of these different cities is, first of all, they know MRSA is a problem. They know it's an increasing problem. It is not just a gay problem, it's not just a sexual health problem, and no, they don't have any resources for surveying how many cases they're getting or how bad it's getting in their cities. So most of the places know this is a growing problem, but there's no money to pay attention to it. And as I mentioned during the protest just now, MRSA is now felt to kill more people than AIDS in the United States every year.
Is that right?
The number of cases has doubled in the last 10 years, and we can consider it likely to continue to go up.
Now, there was a parallel drawn between the AIDS crisis in the early 80s and the coverage of this in the Chronicle. Now, did you see that too?
Yeah, and I think a lot of people who came into the organization felt that this was reminding them an awful lot of what happened 20 years ago when there was a mysterious new disease that was increasing in incidence, and certain groups became pariahs and stigmatized for being the source of the plague and presenting a threat to the general population. As I said at the community meeting back in January, this MRSA staph bug came into the gay community and ravaged it and caused a lot of illness for a lot of people. I've had a number of patients who've had to be hospitalized and have surgery because of this infection. Rather than seeing our community as being yet another group that has been victimized by this infection, like college athletes, like children, like elderly people, for some reason our community becomes spreaders of plagues. You know, when this bug started killing children 10 years ago in Chicago, no one suggested that children were a threat to the general population for spreading their killer staph bug. When Laguna Honda Hospital was studied by the research team that did the study on the Castro, they found a huge outbreak of MRSA and a strain related to the one that was covered in the January story in the little elderly people at Laguna Honda. I don't remember seeing any news stories saying, don't visit grandma in the nursing home, she might give you her killer staph. But I actually had a gay man come to my practice 2 weeks ago who had picked up an MRSA infection from visiting his sick father in a nursing home. So elderly people, children, college athletes, all sorts of groups are affected by MRSA, not just the gay community. And I think that we were unfairly stigmatized as spreaders of a plague, when in fact we're just another group that's been victimized by this disease, which is increasing.
So basically it's a general population disease.
Absolutely. But one of the things that I can say that I'm really proud of is that when our community got affected by this and got some very unflattering media coverage directed at us, I saw people immediately get organized, get together. Our group has been meeting at the Stop AIDS storefront every Monday. And in a short time, we've managed to get a lot done. We've had this protest here today. We plan to have more demonstrations about this. We're working on our report, and we've sent members to meetings at the health department and at UCSF, and here today at the Chronicle, actually, after this demo.
Oh, right.
Yeah.
So you're going to have a meeting with the editorial board? Or?
Yep, they agreed to meet with us after the demonstration today, and we're going to ask them for an opportunity to print a commentary about how this MRSA story back in January harmed the gay community and how we'd like to call for broader and better coverage of this problem.
Well, have there been any other apologies or any other from the media?
It's interesting, the university actually immediately after the story was released, many of the gay and lesbian scientists at UCSF were horrified by the coverage and got together, and in fact the LGBT Equality Center at UCSF has already created a system at the university so that they will review these stories, stories about minority populations before they go out to the press as a press release, so that they can make sure that something like this doesn't happen again. So the university is already doing some reforms, but they've already issued an apology on their website, and we were happy to see that. We think the Chronicle should apologize for the parts that they got wrong.
Very good. Okay. Well,
Right.
Congratulations.
Thanks.
So there you have it. The protesters are now on their way up to go meet with the Chronicle's editorial board to discuss ways to ameliorate the damage from the initial story. And curious to know what your opinion is. So post some videos, post some comments, and let's get a debate started around this. Thanks for watching.